because we're going to be hearing from our school psychologists, our school social workers, as well as our school counselors. And so let's just go ahead and start with, we have John Smeaton, school psychologist, that's here with us. John, kick us off. We can't hear you.
Okay, it says I'm unmuted.
Okay, you're good now.
Thank you for this opportunity. We just want to talk a little bit about mental health in schools and how we can get kids what they need. I'm not real good at I prepared some statements, but I just want to kind of go through what we're seeing and what we're doing, and then I have submitted some written testimony that we can look at as well. But yeah, just thank you for the opportunity. I'm John Smeaton. I'm the current government professional relations representative for Kansas Association of School Psychologists. It's my 5th year as a school psychologist in Kansas. I've also had experience teaching in a general ed classroom, and I've worked in the community as a mental health substance use disorder technician in residential treatment facilities. A little bit about school psychology. I think that the notion is, or the conception of school psychology is, we're the people who do the test for special education. But our role is so much greater than that. Our role is to foster student success for all students. Our standards for professional and ethical practice go beyond just the testing data collection role. We strive to create positive change for all students, families, and schools. We have training both in mental health and in schools as a system. And I think that gives us a unique opportunity to be able to help students navigate those systems to be successful. We provide direct mental health services, consultation with teachers, families, direct intervention strategies, leadership roles, advocacy efforts. We look to utilize these roles to create safe, inclusive, accessible educational opportunities for students. Our national organization just released a new practice model. It looks like a wheel. There's 10 domains of practice. And it all has to do with data making, database decision making, because we want to make decisions about students and their needs based on what the data tells us, not on what we think or what we feel. We also look at specific student needs, which we can intervene and consult and make those service provisions for students. We are an integral part of the school mental health team, along with social workers and counselors. Today we join with them to just provide information regarding the impact of mental health on students. And again, especially this year, with kids returning to school after last spring and having some, we got a lot of families going through job losses and kind of that shifting dynamic there, which creates stress in the family, which creates stress in the home, which kids feel. Our roles are expanding. I think for a long time we were the test in place kind of role. But kids have needs greater than special education and outside of special education. And so, we're situated to be able to provide for those needs in a school setting and help kids and families navigate systems. Prior to this school year, now I know that there are some districts in Kansas that have not been full whatever up till recently. We've been in school. We started late. We started like in September, but we've been in school in person, 5-day-a-week learning all year long. So it's given me an opportunity to kind of talk to kids and figure out what their needs are. Prior to this year, I never had a kid come to my office and talk about being worried about grandma being sick or dad being sick or mom or getting sick themselves. When kids are thinking about these things, learning algebra is really difficult. So being able to address, again, those needs and provide those direct services and help kids feel safe in an environment that's it's a little bit scary is important work. During the pandemic, I'm gonna have a look at my statistics here. The Centers for Disease Control, from April to October 2000. So from schools closed down in March, so April to October, hospitals across the U.S. saw a 24% increase in the proportion of mental health emergency visits for children ages 5 to 11, and a 31% increase for children ages 12 to 17. That's the age group of our students. That's what we're dealing with. So, as stress increases and not knowing how to deal with and those kind of stress levels has been difficult for our kids. I'll be honest, I'm not entirely sure that the full effects of this pandemic will be known for years. We do know that this year, both students and teachers are experiencing unprecedented levels of stress due to social isolation. Online schooling has been a challenge. Worries about being sick or contracting COVID. Loss of routine. School students find safety in that everyday being in the building routine. Loss of income due to job loss and layoffs. Again, kids may not have to deal with that directly, but they're certainly impacted by family stress. And of course, we have lost kids have lost family members due to the illness. So 1 in 5 children and adolescents experience mental health problem during their school years. And this was data collected prior to the pandemic. So that has, since then, of course, there's been more social isolation, mass job losses, deaths. Self-injurious behaviors and suicide are on the rise. We've all seen the headlines, particularly among youth. It's been estimated that up to 60% of students do not receive the treatment they need due to stigma or lack of access to interventions. Of those who do get help, 2/3 of those do so only in school. So school is the place where kids seek out these services. And since they spend a majority of their day there, it's a great place to provide them. Left untreated, these mental health concerns lead to increased treatment costs, addiction, dropping out of school, suicide. 90% of people who have died by suicide were suffering from a mental illness at the time. I have personally conducted more suicide risk assessments this school year than my previous 4 years combined. It's a very uncomfortable place to be. So kids are suffering, and we need to come together and figure out a way to make sure kids can get the services they need. There was a Harris poll conducted by 4-H just in June, just this last summer. This was a self-report measure where they just gave kids and they self-reported 7 out of 10 teens experience struggles with mental health. As many as 1/3 of teens feel anxious or depressed daily. 53% of teens responded that they spend more time deciding what to listen to on Spotify than how to deal with mental health. This is a skills deficit. We tend to have a belief that if we ignore things, they'll go away because we've not been able to teach. These are skills we can teach in the schools. Mentally healthy children. Let me back up. When we talk about mental health, I want to talk about more than just the lack of having some alphabet soup of diagnoses. Mental health is feeling safe, secure, and happy. You can not feel safe, but not necessarily qualify as a student with ADHD or ODD or whatever. But students that are truly have truly good mental health have a certain happiness about life in general. And they're optimistic, and they can see the future, and they can see themselves being successful. So yes, mental health concerns are real, but it's more than just the at-risk type things of ADHD and ODD and depression. These are skills that we can teach in schools. Resiliency is key to overcoming adversity. We can teach resiliency in schools, and we do so every day. Schools are an ideal place to provide mental health services to children and youth. Virtually every community has a school, and most children spend at least 6-7 hours a day there. School employed mental health professionals like school psychologists, our counselors and social workers we work closely with, and nurses. They know the students and other school staff. They know the families a lot of times. So this contributes to accessibility of services. Research has shown that students are more likely to seek counseling when services are available in schools. So they're less likely to go visit a community center to get their needs met. School mental health services support the mission and purpose of schools, learning. We can teach strategies and skills to overcome those mental health concerns we have. As school psychologists, again, we understand the mental health piece, and we understand the school as a system piece. So we can help students focus on navigating that system and with families as well. So we can collaborate with families and have better outcomes for kids. Again, our services can range from prevention to skill development, intervention, evaluation, referral, collaboration. All of those things are part of the holistic approach we take to mental health services in schools. It's a continuum, and providing this continuum of services is critical to effectively addressing the breadth of needs that students have. Comprehensive services are most effective when they're provided through a multi-tiered system of supports. So we're providing basic mental health education to all students, to kids who, same thing we do with like the dyslexia stuff, right? Or the learning disability stuff. We're providing universal instruction. The kids who need more support to get to the level we want them at, we can do kind of more intensive, and then our most intense kids, we can provide that as well with direct services. Access to adequate staffing of school employed mental health professionals is essential to the quality and effectiveness of these services. We just don't have enough of us to meet needs right now. And I know this is something you've heard before, because we've been here 2-3 years in a row saying we need more school psychologists. Again, we won't likely know the full effects of COVID, of this pandemic, for several years. Not only with the mental health piece, but there's some warning concerns as well. But if we want to make progress in the area of mental health for our students, we must commit resources to getting people into these fields. School-based mental health professionals are all required to have at least a master's degree in their respective field, and school psychologists actually have an ed specialist, which is master's plus. My program was 30. So getting people to commit to a field like this for the money they make is really difficult. Additionally, it's really hard to meet all the needs whenever I know that, like, our school counselor ends up doing a lot of administrative work. School psychologists, we're stuck. We're in that role of test and play, special education stuff. So the more of us there are, the more we can share that workload and better meet kids' needs. I do have some specific policy recommendations. I don't want to get into all that. I'm not about making policy. I want to just let you know what we do, where we are, and what we need from you. So with that, I'll let my colleagues speak, or I'll take questions, however you want to proceed.
Let's listen to Stacy, And we are going to have to watch our time a little because we only have about less than 40 minutes left, and we want everyone to have an opportunity to speak, and we want to ask questions. So Stacy, are you with us?
I am, but I'm not presenting. I'm just supporting Jonathan. And so I think it was, I'm not sure who was next, but I'll let them pipe in. We have our counselors and social workers next.
I have Norella down as far as our social worker from Topeka Public Schools. And
Norella,
Samantha.
are you ready?
Yes, I'm ready. Thank you. My name is Norella Munoz, and I'm a school social worker with the Topeka Public Schools District USD 501. I'm also the acting co-legislative chair for the Kansas School Social Workers Association. It's really almost impossible for my own personal experience to speak for the entirety of school social workers in Kansas, but I really hope that the testimony that I give will encourage you guys to do some thinking about supporting issues that affect the people that we work with, which would include Medicaid expansion, funding school mental health intervention program, which we can talk about. I know that was one of the questions that the House Education Committee had, was how the school mental health intervention program that was instituted a couple of years ago has been helpful to us in our schools. I'm lucky in that our school district has a pretty robust program in place, and we've been able to utilize this program to get some good mental health supports for our students through the Community Mental Health Center, which does help to alleviate some of our burden as school social workers, counselors, and psychologists in the district, because honestly, there are not enough of us to go around to meet all of the mental health needs of the students that we have in our school district. The other thing that our organizations were in agreement that we wanted to encourage was maybe having some incentives for professionals to pursue careers in school mental health. Like Jonathan was saying, these positions do require a master's level education. There's a lot of time and money and effort that goes into getting these degrees, and sometimes the pay is not, commensurate with that. And we want to make sure that we're encouraging the next generation of counselors, social workers, and psychologists to get into the field so that we can continue to help keep kids mentally and emotionally healthy. One of the things that we do as social workers, I can kind of just run down. They're very similar duties to Jonathan. I myself, as a school social worker, do participate in doing evaluations. A lot of it has more to do with looking at the family, because when we're doing these evals, we're looking at the whole child and collecting information on their social emotional health, as well as their physical health, because sometimes these issues do affect their ability to do well in school. So, we participate in doing these evaluations. Other proactive efforts that we do include anti-bullying campaigns. We work with students around suicide prevention, character development. We help students and teachers develop positive behavior interventions and supports. And we do all that using trauma-informed practices. Another thing that we provide direct services to students. So, a lot of our day is spent doing small group interventions with students, focusing on social skills, conflict resolution, coping skills. We also do individual counseling. Myself, I work at the high school level, so a lot of what I do is mostly around individual counseling with students, as well as working with the families to try to get them the resources they need for their student to be able to be successful in school. This is a little bit more difficult than the last time. I'm used to being able to read a statement, not just kind of going off the cuff, so I apologize for the lag. a lot of our students are struggling right now because of, some restrictions that have been imposed by COVID and just COVID in general. I know that we have students, like Jonathan said, whose parents have lost employment. They're not able to access food, or unable to pay their bills, including their rent or mortgages, and all of that stuff weighs heavily on kids and families. There's, along with these issues comes an increase in mental health issues, including anxiety and depression, and in all the family, parents and students included, as well as substance abuse. And so it's critical that we have the staff needed in our schools to be able to address these issues, especially as kids are starting to come back full time. Thankfully, now that things are kind of looking up a little bit and people are getting the vaccine and we're looking at opening our schools back up full time, I think we're going to, like Jonathan said, see the full breadth of, the impact of the pandemic. And we're going to have our work cut out for us. And I just wanted to be sure that you guys kind of got a sense of what we do as school mental health professionals, and that you get a sense of how important that is. Schools are kind of a hub for the community. A lot of families aren't well informed in what community resources are out there. And so they rely on us a lot as just kind of a central point to be able to access those services, as well as, other things that they might need to be able to make their families function. I just want to take a minute to thank you for your time, and I look forward to getting your questions.
Oh, thank you. Now, is Samantha going to speak with us also?
No, she wasn't able to be here with us. They have a little bit of a staff shortage in her school, so she is busy.
Okay, we will move on is Lindsey Brown with us, our school
Yes.
counselor? Lindsay.
Yes. Good afternoon. Thank you for allowing me the opportunity to address the essential topic of school-based mental health. My name is Lindsey Brown, and I'm a current school counselor at Mays South High School in the Wichita area. I've been a school counselor at the elementary, middle, and high school levels during my 9-year career as a school counselor. I'm currently serving as Kansas School Counseling Association's future president, and I was recently awarded Kansas School Counselor of the Year. I'm also completing my PhD in counselor education and supervision at Kansas State University, actually defending in a little over a week, and have already began teaching future school counselors through adjunct teaching positions at both Emporia State and Wichita State. Today I'm going to be sharing with you the role of a school counselor, my experiences counseling in a pandemic, and then kind of some ideas of how you can help support and enhance school counseling in the state of Kansas. I am super passionate about the role of a school counselor. School counselors are in a unique position because we serve all students in the school setting. The American School Counseling Association defines the role of a school counselor as a certified licensed educator with a minimum of a master's degree in school counseling. And we are uniquely qualified to address the developmental needs, again, of all students through a school counseling program addressing the academic, career, and social emotional development of all students. According to the CDC, school counselors serve as protective factors for students as they reduce the impact of trauma in students' lives and encourage lifelong healthy choices. The ASCA national model was designed to be a framework for school counseling programs and outlines the components of a school counseling program that have a positive impact on the student achievement and overall wellness. Programs that are rooted in the concepts of the national model are data-based, delivered to all students, teach the mindsets and behaviors, close achievement gaps, and improve overall student achievement, again, for all students. Simply put, school counselors impact achievement for all kids. As a practicing school counselor, my role is integral in students' lives, even long after high school. I have coffee with past students, go to their sporting events, and still serve as an advocate and listening ear for them long after they've walked across our stage. The connections I have with these kids and so many other counselors have with students serve them in a multitude of ways. Having an adult who's empathetic, non-judgmental, and is willing to advocate for them through tough times in their life can be the most meaningful connection a student can have. During the pandemic, school counselors have been an essential first line of defense for students, their parents, and school staff. Our job has definitely had to morph this year, but school counselors are always up for creativity in their approach and to meet the needs of all students. In my experience this year, mental health has often been discussed in board meetings as a reason for students to go back to full in-person learning. But instead of school counselors being used to instill comprehensive programs in our schools, school counselors across the state have been thrown administrative duties such as facilitating remote program schedules, transferring students between remote learning and in-person learning, and spending large amounts of time tracking grades and contacting parents of failing students. If school counselors were allowed to find creative ways to implement comprehensive programs during this pandemic, I believe there would have been a trickle-down effect of students being more engaged and more successful academically. Maslow's hierarchy of needs outlines that students need safety and a sense of belonging before they can learn and grow. Yet we were so drowned with administrative tasks, we're not always able to be receptive to those needs. School counselors could have been providing small counseling groups, meeting in socially distanced groups in school buildings, providing needs surveys to gather information on what students need most, and implementing meaningful classroom lessons and Zoom calls with students. Some of us were able to do those things while also doing the other tasks asked of us, but it was also a year where burnout was in full force. School counselors, like many teachers and administrators, put their own wellness aside this year to work many more hours than contracted. For months, we have watched as parents and school board members have discussed that students are struggling with anxiety, depression, and isolation during the pandemic. However, we have still not begun to mandate comprehensive school counseling programs and a reasonable ratio for school counselors in Kansas, addressing the issues at their very root. This brings me to my final discussion. What can you do as a committee to enhance the mental health in schools for all students? Number one, mandate a 250-to-1 ratio of students to school counselors. The hiring of more school counselors would increase the ability of a school to establish rapport with all students, creating meaningful and productive relationships with adult advocates. Adhering to the recommended ratio results in higher graduation rates, less disciplinary incidents, and increased school attendance. This ratio has also been found to provide a more positive school climate. If this ratio were mandated in Kansas, school counselors would have the time and resources to work directly with all students and help them to feel more connected to their school community. School counselors have many important roles in the school community and often have many more students on their caseload than the recommended 250-to-1. The current ratio in Kansas average is 431-to-1. This would be comparable to a teacher having 50 to 60 students in a classroom. It would be completely unacceptable. The ratio is also important because data suggests that students in smaller schools feel more connected to their school than those who attend larger schools. As one can imagine, with large populations, it's more difficult for the adults in the building to establish and maintain positive relationships with students. These ratios play a particularly impactful role in the school careers of low-income and potential first-generation college students who often must rely on their school counselors alone for support, but also often experience trust issues with adults in their building. This can be mitigated by responsive counseling services when the school counselor takes the time to explain and scaffold the process of post-secondary experiences. Our state is listed on the American School Counseling Association website as providing too few counselors to students of color and low-income families in our state. Number two, mandate comprehensive school counseling programs. When programs are fully implemented and school counselors are allowed the time and resources to work directly with students, students earn higher grades, are more prepared for post-secondary success, and the programs create more positive climates in their schools than those schools that do not have comprehensive programs. Oftentimes, school counselors are faced with being asked to take on responsibilities that ASK outlines as non-school counselor activities. These include things like building the master schedule, test coordination, and student discipline. All of these activities take away from time that the school counselor could be spending directly working with students and can actually be destructive to the relationships school counselors attempt to build with students. When the role of the school counselor is inconsistent or contradictory, it creates a barrier to the trusting relationship and an impossible mission for school counselors. School counselors can't discipline a student and then try to establish a trusting and non-judgmental relationship. 80% of a school counselor's time should be spent on direct services such as instruction, appraisal, and counseling. These direct services are delivered through core curriculum, individual student planning, individual and group counseling, and responsive services. No more than 20% of a school counselor's time at work should be spent on planning and support of a program. All of these factors play a role in how much of a school counselor's time can be spent directly with students, and if the student can trust that a school counselor will be a consistent adult in their life. Number 3, hire more school counselors and ensure that all students have access to a licensed school counselor in their building. While other mental health professionals are valuable members of a school community, they do not possess the educational preparation to implement comprehensive school counseling programs and should never replace a school counselor. School counselors are required to possess a master's degree and are uniquely qualified to address all students' academic, social, emotional, and career development. School counselors are unique from other school personnel because they provide services to all students, which is different than others. While mental health liaisons can also be beneficial in a school setting, their job is to connect students to long-term therapeutic resources and are not used for acute issues occurring during the school day. Each of these mental health professionals have a part to play, but in order to allow comprehensive programs to be implemented and the benefits to be reaped, more licensed school counselors are needed. School counseling programs are preventative in nature. We're working with all kids, even those who might not have tier 2 or tier 3 mental health concerns. By doing this, we're able to curtail mental health issues early, teaching coping skills and showing students resources that can help when they do have those needs arise. School counselors are one of the few preventative mental health resources we have at our disposal, and we need to hire more. Because between 70 and 80% of adolescents with a mental health disorder are not receiving treatment, school counselors are often the first and only line of defense. Additionally, students who receive counseling services at school are much more likely to follow through with services compared to only receiving community services. I so appreciate your time and consideration of the proposals that I put forward. I'm so grateful for the opportunity to share my passion about the empowering work that school counselors are doing in the state of Kansas. And I'm so glad that you know and value the work as well. I want to make sure that I take the time to say how proud I am of our teachers and how hard they have worked this year to ensure continued success for our students, even when given near impossible tasks. I'm also so proud of our administrators who have tried their best to advocate for their staff and to ensure that all needs are being met. Also, how proud I am of our students. I'm amazed daily by their resilience, understanding, and insightfulness. It's a privilege to work with these people every day, and I'm so grateful for it. Thank you for your time.
Thank you very much. And last up, we have Dr. Judith Huey, Coordinator of Counselor Education, K-State University. She's also on the Executive Committee of the Kansas School Counselor Association. Are you with us today, Judith?
I am. However, I am not presenting. I only shared my written testimony. Thank you so much for the opportunity for all of us to share our stories today, though.
Okay, thank you very much. We're going to start committee with some questions, and I know that Senator O'Shea is online, and we will start with her.
Thank you. Good deal. Thank you all for being here and all for the work that you do. And thank you, Madam Chair. Lindsay, you had mentioned that you would like the ratio to be 250 to 1. Do you know what the current ratio is? Is there an average? Do you know what's the ratio in our school Kansas?
Yes, the current ratio in Kansas, ASCA gathers it every year, is 431 to 1. In my current building, I work in a high school, we are 388 to 1.
Thank you. I do have one more follow-up
Did you have
question, if
another
that's all right.
question?
Yeah.
Okay.
Yeah, you had mentioned that you wish you'd had more opportunity to be creative during the pandemic in terms of meeting the needs of students. Did you feel like how that autonomous agency within your role, right? Were you being required to do these things from superintendents or your school boards, or where was the hang up in not allowing that agency? Thank you.
Great question. So when all of the pandemic started, we started hosting kind of like coffee chats with our counselors across the state. And something that we started to hear is that they were just burnt out because so many school counselors were being asked to do the things I kind of suggested, to facilitate remote learning. I know that's been something that we've had to do in our building, to kind of facilitate like the back and forth if students want to go remote or if they want to be in person, facilitate a lot of schedule changing. I know a lot of our elementary counselors have even been, covering classes. It's just kind of been all hands on deck. And I think we all definitely understand that role, and we want to support our schools to the best of our ability. So I think all of us have just been jumping in the way we've been asked to. But I do feel like there's definitely been talk in those meetings that we've had that school counselors feel like we could have been utilized a little bit differently. I think as we've been coming back, I'm starting to see our role kind of shift back into being true school counselors. I think it also comes with the disconnect of years past, that school counselors, are perceived as guidance counselors, those people that are just giving you advice on college and helping you with scholarships and essays. And that's definitely part of our job, but we're not always seen as the mental health professionals that we are. And I think that disconnect from before has kind of just trickled into the pandemic.
Sykes.
Thank you, Madam Chair, and I have a few questions, but thank you for being here, and I just want to say thank you I have been very appreciative for school counselors when my family moved mid-school year. It was the counselors who helped my children adapt to a new, not only school, but school district in the middle. So thank you. My first question is, the communities that care survey that we have always done, and that went from, instead of being opt-out into opting in. Can you tell me how that has evolved? And I know there was maybe a little bit of improvement in getting students to take that survey, but can you address that? And it's for any of you.
As a school psychologist, I would just say that I have not been involved with the communities that care. So I'm going to pass that on to someone else to possibly answer. Hate to dump on you, Lindsay, but do you want to take that one as well?
I can sure try. We also have not had a huge part of the communities that care survey. I know that it's given in our building. We started moving into the direction of using the BASC this year as a screener for our kids. And I'm so excited about being able to use those mental health screeners to really look at data and be able to build a really solid MTSS model around social emotional health. And so I guess I wish I could speak to communities that care more. I know that it's given in our buildings, and I know that data is looked at, and I think it's mostly looked at administratively, but it is data that's shared out with us as well. But I'm really looking forward to that BASC data because it gives very specific student data and allows us to kind of identify, not just at-risk academic students, but students who are who are at risk for social emotional needs as well. I know that's speaking to maybe more than what you're asking about, but I guess that's the part that the screener is something that I have specifically worked with this year.
Thank you. I appreciate that. And this question is for Norella. You mentioned specifically Medicaid expansion and how that would assist. Would like you to go into detail about a little bit more how that would help, especially now that we're looking at the federal government would give $460 million to Kansas if we expanded. So I have always thought we were short-sighted without Medicaid expansion, but if Norella could talk specifically of how she sees this impacting our schools.
So the way in which I see that impacting our schools is through, covering the parents and, children who kind of fall in that kind of gray area income wise where, they may not be able to have their parents pay for health insurance for them, or it's very costly. But, they also are not able to qualify for Medicaid. It would provide approximately 165,000 more Kansas people with insurance coverage to cover basic health needs, which I think is really important so that people can be proactive and preventative in their health instead of ending up at emergency rooms or, to address physical or, mental health situations. It would reduce financial burden for, the rest of us as well. Children would have increased access to services that they need, including mental health and dental, physical, so that they are able to get those needs met and be proactive about it, which would in turn lead to them being healthier individuals, missing less school, which of course would affect the academic and social outcomes for them.
Thank you. I appreciate that. And especially where you're talking about, wraparound services. I know a lot of times the child can get those services, but if you're not addressing, the issues for the whole family, and I have heard that specifically from my community mental health, that expanding Medicaid, even though the child may be getting some services, they could really address the problem for the family. So thank you for clarifying.
Senator Dietrich.
Could I just jump in and address one more thing there to tag on to Norella?
You may.
Would that be okay?
Yep.
So what I see personally is a lot of students come to us. We work with them. We work with their parents on getting them outside mental health. Obviously, we do what we can within the schools, but when it needs to go to, we're not therapists. We are addressing individual issues as they come up and trying to work with students on how to maneuver the school day when they're struggling with mental health issues. But what I've seen more than anything is, as far as Medicaid expansion, is families that are working, maybe a single mom who's working or two parents are working, but they are not making a lot of money, but they're making just enough to not be eligible for Medicaid. So they're living paycheck to paycheck. They are willing to get their students or their children outside therapy. We refer them to the local mental health agency. They go do an intake and they discover that it's not going to be covered, or they don't have insurance. It would only be covered if they qualified for Medicaid. So when they qualify for Medicaid, they get those services right away. You would be amazed how quickly things move when a student qualifies for Medicaid. When they don't, then the mental health agency says, well, we have a sliding scale, which means they wouldn't have to pay as much, but they would still have to pay. Well, these families can't do that. They are living paycheck to paycheck, and they can't even pay a sliding scale, even if it was $10 or $20 a month. So that's where we are seeing the need for that Medicaid expansion. These families are working and they're trying, but they're not making enough to pay privately, or they are working, but they're not making enough to afford insurance, or private insurance does not cover these types of services. So that's been a big issue that we have seen over the years.
Straub.
Thank you, Madam Chair, and thank you all for your testimony. I know I referred to this article before in previous committees, but previous research on different coronaviruses, including SARS, from almost 20 years ago, showed that the findings were that school closures would not, the public health benefits of school closures would not be proportionate to the social and economic costs for affected children and families. My question for all of you is, do you agree with that? I know John had mentioned the increase in mental health issues in children. So how could we handle this differently, in future health crises? Do you agree with the findings of this research that school closures definitely negatively affected mental health of students?
I think it's really hard to argue that it didn't, but I also don't want to have it be kind of a black and white answer. I know that we did what we needed to do in order to keep people safe at the very beginning of this. But I also think that now that, we're seeing the light at the end of the tunnel, we are seeing that, people are getting vaccinated, our numbers are going down. This is probably the time to start looking at, opening schools back up and, addressing, the needs of students. But again, I just don't, I want to urge you guys not to think of this as a black and white. We know that, kids' mental health was affected by the school closures as well as their academics. I think we were doing the best we could at the beginning of this. It was something that was unprecedented. We haven't had a pandemic like this in 100 years. And I think if this were to happen again, we'd be a lot better prepared, better equipped to handle it, and have some things put in place for our students so that, we were able to keep track of them a little bit better and, to address their mental health needs.
I think just piggybacking on what Norella said, I think something that I dealt with and we dealt with as a department a lot were also on the other side of that, students being really scared to come back to school, students being really scared they were going to bring something home with them. We had some students who really thrived in online, but definitely they were impacted by the pandemic. I think what we can do to prepare for anything that would be happening in the future is to start being preventative now and putting school mental health professionals in place. We have some elementary schools in the state of Kansas who don't have school counselors at all in their buildings. That's a really good place to start, I think, to really start being preventative now so that when if we were to have something like this in the future, we have all those resources in place. Elementary schools are so important for kids to be starting to get the skills that they need to cope and to be resilient, because honestly, kids are so resilient. And that's something that I've seen throughout the pandemic and working with our kids. But I think, we've had kids lose parents during the pandemic, and it's been really hard. But I think what I would say is the most important thing is that we start putting preventative measures in place now, which means hiring more school counselors, more mental health professionals that are in the buildings working with kids daily, and really working to decrease that ratio in Kansas, and making school counselors available to all kids in every part of Kansas.
Senator Dietrich.
Thank you. Thank you all for being here today, and your last statement about needing more counselors at the elementary level and, reducing our ratios, that's been around for a while. So it's not new information, and I completely understand. Part of the problem, though, in the past has been we just don't have enough counselors. They're not getting the certification. It requires a master's and then some clinical time, and we just don't have very many folks out there that are willing to do that. So what do you suggest? I mean, what would be, you can't increase the numbers if you don't have the staff to do it.
Absolutely.
What are your thoughts?
Great question. I think, loan forgiveness programs, eligibility for school counselors to access loan forgiveness programs, grow your own programs. I think something else to really think about is that our school counselors, go through almost 60-hour programs. To be in an accredited program means that you've gone through a 48 to 60-hour program, master's level program, which is a huge number, like you said. But then when we get out of our program, we're paid like a teacher with a master's. We're put on a teacher pay scale with a master's who might have a 30-hour master's program, or even administrators who have far less hours in a program but are paid significantly more than we are. So I think, looking at grow your own programs, looking at loan forgiveness, eligibility for school counselors, and finally, looking at the pay that we're paying our school counselors and our mental health professionals in Kansas. I'm not sure for social workers and school psychs, they would have to speak on that, but having the availability for a school counselor, actually one of the administrators that I talked to recently just told me, man, I was going to go into school counseling, but it just wasn't worth the financial return, which is so true. And I think we do have a lot of people who are really qualified and who would make amazing school counselors. I know great teachers who would. But I think we have to put some things in place to really incentivize going into school counseling. But I think, I work with interns and practicum students right now who are going out in the field and who are looking for jobs and who haven't found them yet. So, I think we do have a lot of great people coming out of our programs, and Kansas universities across the state have great school counseling education programs. And I think if we can increase those incentives, then we're going to have an even heavier flow of school counselors into our buildings.
Senator
I'm
Petty.
going to say that's the same for all of us, for social workers and school psychologists as well. For school psychology, we do go beyond a master's and go to that education specialist. And then we have a full unpaid semester of a practicum that kind of equates to student teaching. And then we have an entire additional year that's an internship year, which is paid, but you're still doing things for the university. It is a lot. And so that's what we've talked about, and we talked about with the House Education Committee as well, is like Lindsay said, loan forgiveness would be a biggie, or some type of incentive program that would allow people to go into this. So scholarships for teachers. One of the things we've done through ks for school psychology is we have a program where we're reauthorizing people that are special education teachers or social workers or school counselors, and they can take a fast track in a school psychology program to become a school psychologist. But then we're robbing Peter to pay Paul, because then we lose a good school social worker. And what I'm personally seeing is school social workers and clinical counselors as well out in the community mental health agencies. They have a ton of turnover as well. We cannot keep therapists. So when we want to send our students on to an outside mental health agency, we can't keep therapists. It's the same thing. The burnout is so high because mental health is a very stressful field. So I think we've got to look at salary. I mean, we're on a teacher salary schedule. We do have, we have more education, so we're further along on the salary schedule, but we bottom out really quickly, and then we just don't. When you can't go over or down anymore, we just don't make any additional money at all. So I was frozen for 10 years without anything additional. And some of that just came to the overall education funding. Fund our schools so that you can put money on those salary schedules. We all benefit, but we went for, like I said, 10 years with getting almost nothing. If you don't have any place to move over or move down, I'm retiring this year, so I was in my 20th year as a school psychologist, plus I taught before that. I haven't been able to move in 12 years, so I've been frozen on that schedule. But really, some type of scholarship program, and what we're seeing in school psychology is we're really lacking in those rural areas. So out west, where they can't fill the positions. We are finding we're shifting a little bit more to be able to fill the positions in our cities and our bigger towns, but we can't fill those positions out there. So even when you say, hey, we'll forgive you if you'll go to liberal and work for 3 years, we'll forgive your tuition, we still can't get people to go out to those areas. So there's a lot of different things to look at there, but some type of scholarship program, because the bottom line is the more we can deal with mental health in the schools, the less you're going to have to deal with mental health when these people are adults, and then they are a drain on the system because they've not had those supports or those the therapy, whatever, all the way through. So it's also very difficult to get our more severely mentally ill students into PRTFs. They basically have a residential treatment facility. They basically have to say that they're going to kill someone or kill themselves to even get more significant treatment, to even get into a program. So that's been going on for several years, that there aren't any beds available when we do have students that are suicidal or beyond, or have just really super significant mental health problems. So we don't have an ideal fix, but we would like to start earlier next year and discuss some specific legislation to get more of us in the schools. I know our high school hired a new college and career counselor. So that's great because she's dealing with all of the new college and career issues that have come up. She plays a great role, but it hasn't helped at all to give us an additional person to address the mental health needs in that building.
I think I don't have any answers as far as numbers because we would like to have our ratios down where we can handle some things too. But I do think that a lot of times our jobs are reactive by nature. But I think what we've done with like the dyslexia legislation, where they've said, you know, you will have K through 12 MTSS tier 1, tier 2, tier 3 type supports. Behavior and socialization is a huge part of school, but it's often overlooked. I think we're now starting to have the conversation, you know, 5, 6, 7 years later. But we need to be at the forefront of that preventative piece. But again, it's a personnel issue. Like, how do we do all we need to do and still be able to be proactive instead of reactive? But I think our focus really should shift from reacting to these needs to trying to prevent them to begin with. You know, we know how to teach resiliency. We know how to teach coping skills. We know what evidence-based practices work for certain conditions. We know these things. We're just having a hard time a lot of times getting them implemented into schools. And when we can, it's often part of an IEP. And I would argue that there are kids who are not disabled, who do not need an IEP, but still need to be supported in a positive way at school.
Madam
Going
Chair,
to, no, yes,
excuse me, I apologize. If I could just very quickly respond.
you cannot. You cannot. I have 3 senators that were waiting to ask questions. And we have participants that said they were just going to sit in that spoke up. We are over time. My apologies to Senator Petty, Senator Gossage, Senator Straub that had questions, my vice chair and myself. I will thank the participants for being with us today. I appreciate your sharing your perspective. We are over time for the committee meeting. The meeting is adjourned.